still about the joints, but focus more on the types of movements at synovial joints. Basically, specific terminology is used to designate the movements that occur at joints. For that purpose, the movements are grouped into four main categories, which are angular movements, rotation, gliding, and special movements. For angular movements, there are several examples of movements, such as flexion and extension, adduction and abduction, and circumduction. Flexion and extension involve increasing or decreasing the angle between the articulating bones, and both occurs in opposite directions. Specifically, flexion is a decrease in the angle between the articulating bones. An example is bend trunk forward, while extension is an increase in the angle between the articulation bones. In adduction and abduction movement, the movement is either away or toward midline. To be specific, the abduction is a movement of a bone away from the midline. For example, is the moving of the humerus laterally at the shoulder joint. While movement of a bone toward the midline is known as adduction movement. For example is movement that returns body parts to normal position from abduction. Last but not least for angular movement is circumduction. This movement is the movement of body parts in a circle. For example, moving the humerus in a circle at the shoulder joint. For rotational movement, the bone rotates around its own longitudinal axis. For example, turning your head from side to side like when you shake your head no. And, in this type of movement, there are several examples, such as supination and pronation, right rotation and left rotation, and medial rotation and lateral rotation. Supination is a movement of the forearm so that the palm is turned upward, while the pronation is movement with palm is turned downward. Differing from angular movement and rotation, gliding movement is a simple movement back and forth and from side to side, with limited range. It also has no significant alteration of the angle between the bones. For example, intercarpal joints. The last types of movements at synovial joints are special movements which occurs at specific joints. There are a few movements under this category such as inversion and eversion, dorsiflexion and plantar flexion, opposition and reposition, protraction and retraction, and elevation and depression. Inversion is a movement of the foot medially and while eversion movement of the sole laterally. The direction of the movements is in the opposite way. For dorsiflexion and plantar flexion, the dorsiflexion is a bending of the foot at the ankle in an upward direction. Opposite to this is plantar flexion where the foot bends in a downward direction. Next is opposition, where in this movement, the thumb moves across the palm to touch the tips of the fingers on the same hand. Protraction and retraction. Protraction is a movement of a part of the body anteriorly. For example, thrusting the mandible outward, while the retraction is movement of a protracted part of the body back to normal. Next is elevation and depression. Upward movement of a part of the body is known as elevation. For example, closing the mouth. Opposite to this movement is depression or known as the downward movement of a part of the body, such as opening the mouth. Last but not least, continue with health problems related to joints. To be specific, joint problems are associated with aging and the musculoskeletal system. Joint problems associated with aging are relatively common. For example, rheumatism and arthritis. Rheumatism is a general term for pain and stiffness in muscular and skeletal elements, while arthritis is an inflammation or swelling of one or more joints, where all rheumatic diseases affect synovial joints, and effects of aging include osteopenia and osteoporosis. Joints, arthroplasty. What is arthroplasty? Arthroplasty is a surgical procedure to restore the function of a joint. A joint can be restored by resurfacing the bones. Basically, the joints may be replaced surgically with artificial joints, and most replaced are the hips, knees, and shoulders. For example, in hip replacements, partial hip replacements involve only the femur. Not only that, but total hip replacements also involve both the acetabulum and the head of the femur. While for knee replacements, a resurfacing of cartilage may be partial or total. Anyhow, the potential complications of arthroplasty rise include infection, blood clots, loosening or dislocation of the replacement components, and nerve injury.